Dr. Ahmed will present effectiveness of coiling of post-percutaneous nephrostomy, vascular complications in control of massive hematuria.
Bismillah ar-Rahman ar-Rahim. Okay, so let's start. Effectiveness of coiling of post-percutaneous renal vascular complication in control of massive hematuria. Renal, as we know all, renal arterial injury can develop following trauma, as in road traffic accident, penetrating trauma, iatrogenic, post-urological interventions, as renal surgeries, percutaneous nephrolithotomy, renal biopsy, and percutaneous nephrostomy. It can presented by life-threatening hemorrhagic complication. Transcatheter arterial embolization is an endovascular approach to control the post-traumatic renal hemorrhage as an alternative to operative correction of renal arterial compromised. The great advancement of the development of embolizing agents as vascular coils, particles, endovascular glue, as well as introduction of microcatheter, enabling super-selective bleeder localization and catheterization with minimal parenchymal loss. The choice of embolic agent depends on site of bleeder, whether proximal or distal, size of injured artery, hemodynamic status of the patient, accessibility of the source of bleeding. Coils are used for proximal larger bleeders embolization, while PVA particles is used for smaller distal bleeders. Glue can be used in hemodynamically unstable patients with abnormal bleeding profile. Our aim of this work is to assess effectiveness of coiling in post-percutaneous renal vascular complication, including pseudoaneurysms, AV fistula, in control of massive hematuria. The current cross-sectional study, this current cross-sectional study enrolled 28 patients with massive hematuria, post-renal interventions from period of November 2019 to October 2022. All of them underwent fluoroscopic guided coiling. Majority of the studies group, 19 cases were males, their age from 39 to 58. The cases were presented with microscopic hematuria in 9 cases, macroscopic mild to moderate hematuria for 12 cases, massive hematuria in 7 cases. Pulse rate ranged from 85 to 160. Hemoglobin mean was 8 plus or minus 3 gram per deciliter. Interval from renal intervention to performing coils were from 8 hours to 11 days. The findings, perineal subcapsular hematoma was found in 8 patients, while bleeding from pelvic cell system in 19 patients, pseudoaneurysms in 21, while AV fistula in 7 cases. Coiling with pushable coils was used in 25 cases, while non-pushable coils in 3 cases. Diameter of occluded artery, mean diameter 4 millimeters, coil ranged from 3 to 6 millimeters. Overall technical success with 95%, clinical success in 93 in terms of absence of recurrent of hematuria with no hemoglobin decrease or no need for re-intervention. 1 case required nephrectomy. Axial CT images show here small pseudoaneurysm and bleeding in renal pelvis. Coronary informative images show a small pseudoaneurysm. Here is MIP images. DSA showing larger than we saw in CT, 2-lobed aneurysm. And post-coiling, there is preservation of other renal vasculature while disappearance of the pseudoaneurysm. Here is another case of axial image showing large penerific hematoma and lower bore hyperdense pseudoaneurysm. Coronary formatted images and sagittal showing the same findings. Here in DSA, there is no abnormality first in the left renal angiography. Then there was a nephrostomy tube inserted in the patient, and I requested the urologist to flushing, and then here is the appearance of, after flushing many times, of large lower pool pseudoaneurysm. Here is after coiling, preservation of the other vascularity of the kidney, about a single small glue, and as we used here a microcatheter. A third case of large lower pool pseudoaneurysm. Here's a short video showing large pseudoaneurysm was early feeding renal vein, suggesting AV fistula. Here the same picture. After coiling, there is this appearance of the huge AV fistula with excellent result after that. So to conclude, iatrogenic renal arterial injuries pose a significant morbidity and mortality. Surgical procedure mostly fail at repair of the renal vascular injury that require nephrectomy. Renal arterial embolization with coils is a safe, minimally invasive technique, very efficient in treatment of renal injuries, as it helps to preserve much renal tissues with possible lower rate of complication and higher technical and clinical success rate. Thank you.
Thank you, Dr. Ahmed.
Thank you.
I have a comment, please.